Hi everyone, Dr. Funke Brown here. I hope you're doing well. So, when I was younger, I actually had a lot of sleep talking and I thought I had outgrown it until I got married. And my husband would tell me, "What were you talking about last night?" I'm like, "What? I wasn't talking." He's like, you have sleep talking." I continued to argue with him until one day he did record a video that showed me sleep talking. And it was quite hilarious because I had this full on conversation that had made no sense at all. So yes, I still do sleep talk, and so today I just wanted to talk about what you call parasomnias, because this is something that we see frequently in children. So parasomnias, including sleep talking, sleepwalking, sleep terrors, and the like, are essentially unusual behaviors that occur during sleep or or transitioning from sleep to wakefulness. And you can have three broad groups. There are three broad groups of parasomnias. There's what you call the non-REM parasomnias, meaning that they occur in non-REM sleep. And that's usually where we see a lot of children have these behaviors. Then you have REM parasomnias as well as an others category, which really doesn't fall into the non-REM or the REM category. Today, I'm going to just be talking about the non-REM parasomnias. So the common non-REM parasomnias we have frequently seen is what you call confusional arousals. And you may have seen your child have this episode where they suddenly sit up out of bed, mumble something, look really surprised, and then go straight back to sleep. So those are confusional arousals. And really, they have no clue. They wake up in the morning and they have no recollection of it. The second one is what you call sleepwalking. And during sleepwalking, the child actually gets displaced out of their bed, may actually walk out of the room. I've seen children go downstairs and leave the house, actually. And so this could be something that could cause a lot of safety concerns. Again, the children seem to be aware of their surrounding, but they are asleep. Sometimes their eyes may be open. And if you try to speak with them or engage them, that's when you realize, oh, they are sleeping. And so those are sleepwalking. And then another one we see, which tends to be a bit more concerning for parents especially, is sleep terrors, also called night terrors. And during the sleep terrors, the child may sit up screaming, looks extremely scared, maybe staring off in the room when you go to the room, just almost as if they're seeing something. They are inconsolable, they may be sweating, they may be, their heart rates may be high, and they just really look petrified. And those are really, really concerning again for the families. Then another group that we see is what you call sleep-related eating disorders. That's not as common in children, but we see it in some of our teenagers where they essentially get up and sleepwalk to the kitchen and eat random things. Some will eat raw, uncooked bacon, rice. I've seen and heard all sorts of things. Again, may then wake up in the morning and have no idea, even despite the fact that they've disrupted most of the house. So in terms of how common parasomnias are, I would say they're relatively common, seen in anywhere from about 15 to 17% of children, and it's more commonly seen in children between the ages of 3 and about 13. You can definitely see it in younger children as well, but that's the common age group. And less common in teenagers. The frequency of it definitely decreases in teenagers and in older children. And in terms of the causes of parasomnias, we really don't know. It's not clear what the causes are. These behaviors just emerge during periods of sleep. There's a family history component to it. So again, like I said, I have sleep talking and my daughter has confusional arousal, so that sometimes when she'll just suddenly sit up, mumble something, go back to sleep. So you can see it in families. Another time when you can see it is if there's a condition like a sleep disorder that's causing sleep disruption, then you can have children wake up frequently from sleep or have multiple arousals is what we call it. And so when they're having those arousals, it can trigger a parasomnia. And then there are other things that can make it worse. And so things like drinking caffeine, which if you watch my previous video, can affect the quality of your sleep and disrupt your sleep. And so that can cause some arousals as well. You can get sleep terrors in children that use caffeine a lot. Then also during periods of stress or illness, again, sleep quality is affected, and that can trigger these parasomnias. And I also see it a lot in children who have insufficient sleep. So if you have a child that's not sleeping the recommended number of hours, they may get sleep parasomnias, sleep-related parasomnias. Now, what do we do with these parasomnias? They can be concerning, they can be distressing. The most important thing is what happens to the child during the day. Are they healthy? Are they otherwise, fine, doing well in school, no problems? Then I could tell you, just be reassured. Most of the time, they will outgrow these events. They will reduce in frequency and then kind of space out, and eventually they outgrow it, most of them. A few times, like sleep talking, for example, you may see it even in adulthood. The other thing that you can do is make sure that there are no underlying medical problems that need to be treated. So if you see your child maybe snoring or, complaining of legs discomfort and things like that, they may be showing signs of sleep apnea or restless leg syndrome, which can trigger this parasomnia. So speaking with your doctor. Otherwise, most of the things that we recommend are essentially behavioral. So having a set sleep time and a set wake time, making sure that you stick to a routine, avoiding caffeine as well, which can be a trigger. And also sometimes I would recommend some sleep extension. And so what that is if they're already sleeping the required number of hours, in that sense, trying to see if you can add an extra 15 to 30 minutes sometimes will help, again, because insufficient sleep can cause you to have parasomnias. And then very importantly, sometimes if these episodes are occurring very frequently and they're really disruptive, they're occurring multiple times at night, or you're really starting to see that, the child is having some disruptive behaviors during the day, behavioral concerns, sleepiness, or anything else that's going on, then you really should speak with your physician. They may need to refer you to a sleep expert, because we do sometimes need to put children on medication for this parasomnias. So that's it. I hope that you learned something about parasomnias. Again, I am not your child's doctor. If you feel that your child has a sleep disorder, please talk to their physician so that you can get the right help that you need. I would love if you like this video, subscribe and share with people in your circles. And also you can follow me on Instagram at restfulsleepmd.com. I'm sorry, on Instagram at restfulsleepmd. And on my website, you can also find me on www.restfulsleepmd.com. That's it. See you next time.